Good morning. I'm Dr. Steve Stites, Chief Medical Officer here at the University of Kansas Health System, broadcasting live with you from the Dolph Simons Family Studio. Delighted to be back with you on this brilliantly cool Wednesday morning where there just wasn't quite the same heat and humidity in the air. Welcome to Open Mics with Dr. Stites. You can find me here every Wednesday talking about all things COVID. In the studio today with me is Colette Lasack, Vice President of RevCycle here at the University of Kansas Health System. We will talk with her more in just a few minutes about the changes in insurance for COVID-19 patients. Also coming up in a few minutes will be Dr. Dana Hawkinson, the Medical Director of Infection Prevention and Control. He's going to join us with a look at this morning's COVID patient numbers. Anxious to have a little bit of a conversation about that after the nice drop yesterday. So we're going to talk more about it with him. But first of all, let's see if there's any reporter questions on the line. Not hearing any.
This is Taylor.
Oh, Taylor, you're there. Awesome. Taylor, we talking Chiefs football? What are we talking?
Hang on, you got to give me just a second to unmute my phone. That's why it takes me a second.
Yeah.
I wanted to ask you about. We heard from. We had one expert we heard from earlier this week talk about that people need to start thinking about being unvaccinated as they would driving a car under the influence of or drinking while driving a car, that kind of thing, and equate the same kind of thing. I've seen chatter on Facebook about the blame being put on unvaccinated people right now. Is the danger for unvaccinated people more to them or to people who are vaccinated getting something from them? Where does the danger lie for people who are unvaccinated or from people who are unvaccinated?
Yeah, that's a great question. It's a fairly nuanced answer I'm going to give you because the danger is multiple. The biggest threat of unvaccinated patients is that we can't get back to real life. Let's be honest. The reason that we are not succeeding in the pandemic in the United States isn't because we don't have a way to get out of it. Denmark's shown us you can get out of this, right? They've shown us that. They opened their society back up. They have a 75% vaccination rate, and all restrictions have been lifted in Denmark. So the problem with an unvaccinated population is that it impacts all of society. It's going to make more people sick and more people die. It's going to prevent the economy from getting back. It's going to prevent all of us from getting back to a normal life because having unvaccinated patients and unvaccinated people is a threat from a health perspective to all of us, both vaccinated and unvaccinated. And the reason it can be a threat even to those vaccinated is because for people who have a lot of severe chronic diseases like cancer or organ transplant, you need everybody to be vaccinated so they don't spread these diseases to you. I think what we struggle with in our country is that we have said that people have the right to choose and we have a lot of freedom around those choices. And those are good things. I would remind us that the preamble to the Constitution says, "We the people of the United States of America." It doesn't say either one. It says, "We the people." And it goes on to list things like provide for the common defense, promote the general welfare, ensure domestic tranquility, secure the blessings of liberty in ourselves and our posterity. Together we ordain and establish this Constitution. Now think about that first phrase, though, we the people. What does that mean? Does that mean we all have such strong individuality that we can do anything we want? Do we get to run a red light? Can we take a car and run it into a building? Can we start somebody's house on fire because we're mad at them? And the answer to that is, of course not. So at what point does someone who's unvaccinated, who can torpedo the lives of others around them, who can help keep our economy from coming back open, who can help us by creating a threat to our daily lives, at what point do we say that it's not okay to do that? And I don't know that I have the right answer to that, but I think we have to say it for what it is. Patients who are unvaccinated are, yes, exercising a right and a choice to be able to do what they want. But in the exercising of that right, they impact everyone. They keep our economy closed. They make schools a bigger threat. They make going to Chiefs games a bigger threat. They make going to restaurants dangerous. They overwhelm health systems, so we can't take care of time-critical diagnoses. There was a report just a couple, like yesterday, I think, about somebody who had to go to, they shopped at 45 hospitals trying to find someone to take care of a heart attack here in our area. I mean, at some point, we have to say it's not okay. And I think that's the struggle. And I recognize that for a long time, folks thought that, gosh, we don't know if the vaccines are safe, et cetera. There have been over 1 billion or 2 billion doses given worldwide. We've given 100,000 doses in the United States. We have an FDA-approved drug. And for all those people who said, oh, they renamed it, it's not the same drug. Yes, it's the exact same drug. Stop that. For all those folks who said it wasn't safe, there are 2 billion doses that say it's overwhelmingly safe. And it's much safer than having COVID-19. It's much safer than subjecting our society to an ongoing risk. So at what point does freedom with responsibility, which is actually how the Constitution is written, with freedom with responsibility, at what point does that become a greater good than an individual's decision to say, I'm not going to be a vaccinated person and I'm going to carry COVID-19 to any population I want to, and I'm going to affect so many people around me? At what point is it not okay to drive your car into a building, to light someone's house on fire? At what point is not okay to shoot somebody and kill them? At what point is it not okay? And I think that's a societal question we are wrestling with. So Taylor, I don't know if I've really answered your question or not, but I've got to give my morning rant by doing it my way. And I think that we just have to try to reconcile at what point is individual freedom trumped by a societal responsibility and freedom with responsibility. There was a fight about the smallpox vaccine, but everybody got it. We saved it. How many lives have been saved because of smallpox vaccine? How many lives are saved because of polio vaccination? At some point, we have to quit fighting about whether or not COVID-19 is real. Of course it's real. About whether it's deadly. Of course it's deadly. About the people who are dying with COVID-19, it's almost all in the unvaccinated population. At what point is it not okay to have an increasingly smaller group of individuals keep the rest of society hostage from getting back to normal life? I think that's the real question we have to ask in the room. At what point is it not okay to have this group of individuals be a threat to all the rest of society, our economy, people being able to go back to work and holding their jobs? At what point is that not okay? And I think that's where we are in this country. I think we have to ask at what point is it not okay? And we have laws, we have rules, and those rules infringe on our absolute freedom to do anything we darn well please. Again, you can't drive your car into a building or a crowd and light somebody's house on fire. At some point, we have to say freedom with responsibility. That's what we really have in the United States. We don't have complete individual freedom to do anything we want. We're in the middle of the greatest public health crisis in over 100 years. At what point is it not okay to do the easy, simple, safe thing? Taylor, did that answer your question?
I think so. It was a two birds, one or multiple stones, I think, situation. But
it may have been.
It came from a conversation or a borderline disagreement I had on Facebook yesterday. Someone suggesting that the media is what this person said, is saying that people who are unvaccinated are to blame for the spread. And I responded by saying, no, all we're saying is that people who are unvaccinated are those that are mostly in the hospital, not assigning blame to anyone. And that was where the question came from.
Yeah, and I would say there is evidence that says vaccinated patients can spread it, but vaccinated patients don't die. They spread it to a much lesser degree. They're much less able to spread it for a much shorter period of time. And, countries would have the Delta variant with a 75% vaccination rate like Denmark are able to start reopening society. Vaccination is safe and it's effective and it works. And, I don't want to wear a mask forever. I really don't like wearing masks outside all the time. I really don't. It's hot in Kansas. It's sticky all the time. I don't like that. But the reality is, until we get everybody vaccinated and try to get back to normal life, then that's what we're stuck doing if we want to stay safe. So I do think that it's clear that vaccinated patients have a much reduced risk of spreading COVID-19 to others. And if you are vaccinated, you're not going to get nearly as sick. You're not going to overwhelm the healthcare resource. So the evidence is just overwhelmingly clear. And I think we just have to say it for what it is, and people try to turn that into a political fight. You can do what you want with the data, but the facts are the facts, and the data, and if you just look at the information, the data is overwhelmingly clear about this point. Other questions?
Thank you.
All right. I'm not hearing any Colette. That means I get to come to you now. As you sat here listening to me go on my little morning rant. Sorry about that. But, we get a lot of questions about insurance coverage during COVID-19 care. And this is your area of expertise. You work on this in the health system with a lot of patients. Just to say, you and I were talking before the program, there are some pretty high bills from patients who get hospitalized with COVID-19.
Absolutely. And, again, if you are one of those patients that are that ill, with COVID-19, which of course we hate to see on any given day, the intensity of the care that's required to really help those patients is extraordinary. And when you're giving extraordinary care with multiple people in the room trying to take care of that patient, those bills are just astronomical. I mean, it's not uncommon for a patient who's here several weeks with COVID to have, well in excess of $1 million bill.
So let's say that, guys, well in excess of $1 million bill. We've had some north of $2 million here.
We have.
And you just look at that and you think what happens when you have to have one or two nurses in the room, a physician close to the room. You may have a dialysis machine. You may have an ECMO machine. You have a ventilator. I mean, there's so much intensity there. People say, oh, that's just too high. Well, no, actually.
No, it's not.
This stuff is hard and it's expensive. Life-saving technology and equipment and medications, that's an incredibly intense service. And if you think about that and you're doing it 24/7 for every minute of every single day, and that drags on for weeks and weeks and weeks, those things really do add up, and it's just hard.
It's hard. I think it's devastating for families who can't be there with their loved ones, and the financial impact is just incredible. And to think too, I think the bigger picture, it's not just the medical bill, but the patient's not working. They don't have income coming in. So it's really getting hit from both sides, if you will, higher expense that they didn't plan for, and now there's not an income.
Earlier in the pandemic, the vast majority of people enrolled in fully insured private health plans would have had their out-of-pocket costs waived if they'd been hospitalized with COVID-19. Some different insurance companies have phased that out. Where are we with that?
It really varies. Most insurance companies right now tend to follow the date of the public health emergency that's been set coming out of Washington, but we've got a few right now that are set to expire in mid-October.
Yeah.
So we're watching that closely, right? We tend to see those follow what the directive is coming out of Washington and what they're doing with the government programs. But again, we don't expect that to last forever.
Yeah.
So.
Yeah, I think, and it's not going to, because at some point COVID-19 becomes part of the mainstream healthcare in the United States.
Exactly.
And again, we can minimize the impact of that. Remember that, folks, when we had masking and we were just beginning to vaccinate, what was our inpatient census here at KU for the acute? We got down to the number 2, right? The number 2, that's
right.
Really low, much better than 100 where we were a few weeks ago. So we know how to manage this crisis. We know how to find our way out of it, and we can save ourselves, millions of dollars if we're not that sick. So what are the changes that you're seeing related to patient reimbursement for COVID right now?
I think, we're seeing a lot of health plans going back to, regular coverage. At some point, they're no longer going to waive those deductibles and copays. But again, as you said, Dr. Stites, at some point, this is going to become part of our mainstream. This is part of our regular healthcare 101.
Yeah. So what about the long-haul syndrome? Are insurance companies, how are they handling the patients who have long-haul syndrome? Because we know they can have symptoms for approximately a very long time.
We've been watching that very closely. We still do not have any guidance from HRSA, right, that they're going to have any special coverage for long haulers. We actually have a couple new ICD-10 codes now that we can use in our charting and in our claims that actually go to the payer. But we're not seeing any special coverage, if you will, for long haulers, and that's really difficult for our patients that are dealing with symptoms for months and almost up to a year now post-COVID. They're really frustrated that their insurance isn't giving special consideration for that.
So vaccines are still free?
Right now, yes. So it's kind of back to the basics, as we saw originally with healthcare coverage. If it's for the testing, treatment, or vaccination, and mostly infusions, so the monoclonal antibody, they're covering. So if it's related to that, that's usually covered without cost to the patient, and that includes those covered by HRSA.
And we've talked about a bill for an unvaccinated patient who is being charged really high. That's got to be really devastating to folks, because you guys then have to try to work with them about how you're going to come up with a payment plan. So how do you pay back $1 million if you've lost your job, right?
Yeah, you don't. So as we've talked before, we do everything possible here at the University of Kansas Health System to help patients secure coverage, whether that's through HRSA, whether that's through Medicaid, whether it's through a plan that might be available on the marketplace. But still, that's a heavy lift for a patient and their family to go through that process. We're here to help. We're always here to help. If we cannot secure coverage, we also have a high discount rate off our bills for self-pay patients. But again, if you're $1 million bill and we're giving you, a 70, 80% discount,
you still have $100,000. Where are you going to find that?
You still have $100,000 and you don't have coverage. So then we're looking at what can we do for charity care, which means basically we've done all that care for free.
Right, and I think the struggle is that, and this is what, when you choose to get unvaccinated, beware the choice. Because if you're hospitalized and you get really sick and you get critically ill, you're unvaccinated, you may become ruined financially, right, by that illness. Not just by our charges. Long haul syndrome, you may never be able to work again.
Right.
I mean, this is folks,
there's a financial impact.
There are so many life impacts to this obsession with the idea that vaccination is dangerous.
Absolutely. And again, we're always going to work with you as a health system to do everything we can to help you with that bill. And sometimes that means we actually forgive the entire bill, right? Which means we're paying all of our physicians, all of our nurses, all of our supplies, and getting nothing in reimbursement. And we take that seriously. We want to do the right thing for patients. But you're absolutely right, Steve. If you're left without the ability to work, for months or a year or a lifetime, that's devastating.
And then you need oxygen therapy. You need all this help to try and keep your life together. And so where do you end up on the other side of that? You may say, I'm not going to get vaccinated. This disease isn't real, until you get sick. We really haven't had very many unvaccinated patients who are that ill say, gosh, I'm so glad I didn't get vaccinated. They're all like, oh my God, how come I didn't get vaccinated? Because just think about it. We talk a lot about death, but what about the loss of your job, the loss of your ability to work, the need to wear oxygen wherever you're going to go? Well, what are you going to say to your family? How are you going to take care of your family then?
I think the other thing that's new that we're seeing now in these recent months is the younger generation that's getting sick.
Yes.
So early on, it was a lot of our older population. And now that we've gotten through that phase and we're into the phase we're at now, for the younger generations, 30s, 40s, even 50s, that maybe had never thought about the fact that they couldn't work for a year or 2 years from now, that is just totally devastating financially to the patient and their family.
Yeah, and so I think this is... I know I've been on a little bit of a run this morning, so I'm just going to have to keep going. Well, thankfully, Hawkeye's here to help keep me steer back on the right course. But at the end of the day, the choice to not vaccinate is a simple choice someone may make. But as your mom and dad, and my mom and dad at least used to teach me, beware your choices, because they're going to define the outcome for you, right? You're going to live with the consequences of that. What are the consequences of getting so sick with COVID-19? We know that hospitalized patients are 90% less likely to get hospitalized, 98% less likely to die. So if you're unvaccinated, and you get hospitalized, you have this big bill, you get long haul syndrome. 50% of patients get long haul syndrome. You're fatigued, you have headaches, you maybe not be able to breathe, you have brain fog, you can't work, you lose your job. Who's going to pay the bills? Mm-hmm. Who's going to pay your own medical bills? Right. Where are you going to go get that health insurance? Well, you can get Medicaid eventually, but only after you lose any money that you have in your house and everything else. This is an unkind, unforgiving, unrelenting outcome of the choice to not make a simple action of getting vaccinated.
Yep.
Beware your choice and fear the outcome. So, okay. Different companies are doing different things to get employees to vaccinate. For example, around 2 weeks ago, Delta, and I'm not talking about the variant, I'm talking about the airlines, Delta Airlines announced a $200 monthly health insurance surcharge for those who are unvaccinated because they recognize that this drives up their costs. 20% of Delta's unvaccinated employees have already gotten vaccinated because of that, or we think because of that. What do you think is driving these kind of things that Delta's trying to do? And does OSHA have a role in any of this?
I can't say that OSHA has a role. What I do think is it's not uncommon for employers to look at where is their risk. And so just like we've seen over the last 10, 20 years, they do the same thing for employees that are tobacco users or that smoke. They tend to get a higher premium surcharge because they're a higher risk based on that habit. So to me, it's really a financial decision that we're seeing by employers. For those folks that choose not to get vaccinated, they're a higher risk for their health insurance coverage to have a catastrophic series of bills that could really devastate any company, especially a small company that's trying to provide health care coverage for their employees. So that's what I would equate it to. I can't say it has anything to do with OSHA. I think, personally, I think it's more just a financial decision and a solid financial decision based on evidence and based on what we see in the facts.
Absolutely. You know, tomorrow we're going to try and talk about this. I'm going to say to my team, we're going to pull the New York Times graph of the rates of vaccination in different age groups, because there's an important point here to be made. And we'll talk a little bit about it more tomorrow. But if you look at the data, for those who are 65 and older, I believe it's 90% have had at least one shot and over 80% have had 2 shots. Okay. If vaccines are so dangerous, how come those over 65 aren't all dropping dead from vaccination when over 80% of those over 65 have had vaccination in the country? Just think about that, right? You got the population he would think would be the riskiest from being vaccinated. Oh, wait, no. They're over 80% vaccinated, which is pushing them to those of us. Okay, I'm not quite 65 yet, so let me be careful. I won't say those of us. Those who are over 65 who have now been vaccinated are approaching herd immunity. You have to be over 65. That's not really herd immunity. But the point is that they all didn't drop dead from vaccination. So save yourselves. Save your family. Get vaccinated. Hawkeye, how are the numbers today?
You know, they're continue to be better.
They're better.
They continue to be better.
They're not good.
They're not good.
But they're better.
But I think they're better in the context of what we've seen the last couple days as far as number of cases in the Kansas City metro area, as reported by the KC Star. So there was a dip, and I was really happy about that. Although the last couple days it seems like the number of cases reported are increased a little bit. Still not to where the peak was for this surge, but on that upward incline. And I think what we have said, Steve, is that it's not necessarily a number of cases, because we know, number one, people may not get tested if they know they've been exposed and they're sick. They'll just stay home. They may have the home testing, which really doesn't get reported. So really that bellwether is the hospitalizations. And from what we've seen this past week or so, our hospitalizations have gone down. Right now we have 38 active infections, with 16 in the ICU, 9 on the ventilator, and 40 in that recovery period, so a total of 78. We should note that of those 38, only 5 are fully vaccinated, and in the ICU, only 1 of those is vaccinated.
See, that's a big deal. And we know that the one that is vaccinated in the ICU has a ton of other health problems.
Yeah. And we should say that Hays has 8 active infections, 7 in recovery. But, interestingly, you bring up that point about vaccination and how it helps improve your risk of going to the hospital, as well as going to the ICU. And there's a good infographic that was reported last week with a series of actually 3 articles in the MMWR, and this signifies that point very well and kind of really elucidate what is happening. So even with Delta, fully vaccinated people had a reduced risk of infection by 5 times. They had a reduced risk of hospitalization by over 10 times, and most importantly, a reduced risk of death by over 10 times as well.
So I can reduce my risk of death by almost 98%
Yep.
if I'm vaccinated. Huh. Let me think about that. Okay, good idea.
Yeah.
Yeah, let's do it. All right. Well, these numbers are better, Hawk, but they're not great. And I think what we have to wonder about still is the opening of schools. Even things like the Chiefs game. I was at the Chiefs game last week. Wore my mask in, wore my mask out. When I went in to get to the bathroom or something, I wore my mask. When I sat outside in the open air current, it's a little windy. I'm feeling pretty safe, and I'm vaccinated. But I tell you what, we're going to sit back and look at the data. Now, so far the Chiefs games. Again, I'm so encouraged by the data coming out of Lollapalooza in Chicago and other things. Little concerned about the data around Sturgis and the motorcycle event. But that looks like most of the spread was from indoors, which is kind of the same story we saw in Massachusetts. The spread was indoors. So I think the story is going to be the one of the same one, that if you can get outside and do things, you're safe. If you're going to go inside, you should wear a mask. We need to keep getting more and more people vaccinated. That helps make it safer as well.
100%. Yep.
Okay. All right, Jess, let's see what questions are out there.
Hey, good morning. Okay, so the first one is from Michael, and he says, Dr. Stites, has recently said we do not want to be another Springfield. So can you explain why he feels he saw in Springfield this dramatic rise in cases, hospitalizations, and death, and then what felt like kind of a dramatic fall off? So I think it's kind of like his disbelief that there would be just a slow, steady climb in vaccinations that would result in a sudden drop of hospitalizations. He's thinking it might be something else. Can you explain that?
Yeah, that's a really great question. And we've seen this around the world, and I'm not sure everybody fully understands it, why there appears to be these surges that last about 2 months and then things begin to drop off again. And there was a couple of nice articles about some of that. And I'm going to tell you, I'm not sure we know all the answers to that. First of all, I'm not sure I would say it was a sudden drop-off. Springfield steadily declined over a period of time. It may have felt sudden because they'd been so high for so long, but they actually declined, and they still have a fairly high number of cases. The second thing is that we think it's probably a result of a few things. First of all, the people engaging in the riskiest behaviors tend to get sick. And then as a result of that, that's when the hospitalization deaths, et cetera, start to climb. A couple of things happen. First of all, some people do modify their behaviors a little bit. Second of all, they do wear a few masks, not a lot in southwestern Missouri. I go there a lot with the Ozarks, so. But I think it does change some behaviors, whether or not it's necessarily masking or just a few unconscious behaviors around. Gosh, maybe I won't go to quite so many big group gatherings. I may just be a little more standoffish around people, and things like that do affect the outcome. Vaccination has an effect, and then there are probably some other variables yet that we don't fully understand. What we do know, and we'll be talking about this tomorrow, I think. There's a really good article that got published in the Journal of the American Medical Association, was it this week or last week, talking about masking from some of the folks over here at KU in Lawrence, and showing again that those areas that are masked do so much better than those who are unmasked. And I would just point out that the numbers in the Kansas City started dropping after we had a mask mandate in the city. And again, Johnson County didn't do it, but the rest of the area did, and I think that's partly responsible. What we have to watch out for, though, is with school reopening and the potential for increased transmissibility in a very lowly a percentage of the population, especially in those under 12 who are unvaccinated or even in high school that have a lower vaccination rates. What we have to watch out for is whether or not there's going to be more spread, like there was last fall, that eventually got traced back to reopening of society in schools, churches, and restaurants. Because I think we could face that same dynamic this fall. So I think of the situation in Springfield, Hawkeye, numbers have slowly fallen. They didn't fall off a cliff. I think a lot of factors probably influenced that. I think some individual behavioral factors may have influenced that.
Yeah, no, I think it's great I think it is an insightful question, but I think it's great to clarify that wording that was used. It wasn't a sudden dramatic drop-off. Looking at the Greene County data right now, where Springfield is, their hospitalizations really started to tick up around that mid part of June, and really didn't. Then they did peak, but they really didn't see that dramatic decrease in hospitalizations really until late August or early September. So when you're in the throes of that and you are living in that community and you are treating people in that community, and I know people who do that and have done that, it certainly was not a sudden dramatic drop-off. It was 6 or 8 weeks of hard work and just trying to get up every day and do your job and try and keep people safe. But I think more to what you said, it's really about those behaviors maybe that were modified at that point.
It's interesting too that that is not an uncommon curve.
Yeah.
Right? That 2 to 3 month big surge, and then it starts to drop off, and you're like, what has changed? And again, sometimes we can trace it back to masking. Sometimes we can trace it to increases in behavior, social distancing, all those things we know that clearly have worked in this pandemic. Yeah. But sometimes we don't always know, period. And I think there are probably other factors at play that we'll have to spend years and years trying to dissect. But just to say, Springfield's still relatively high. They're not back to where they were.
No.
Okay. Jess?
Okay, so Isaac wants to know, should unvaccinated people be charged higher insurance like smokers have been?
Okay, Colette, this is your question. You brought up just a moment ago. Let's think about that a little bit more.
Yeah, should they be? I mean, that's really not mine to say.
That may not be our question either.
Yeah, it's probably a question for Blue Cross or United Healthcare, honestly.
Hey, we should get Blue Cross executives on here.
We should get Blue Cross executives on here to answer that question.
Let's talk about the DME United and talk to them.
But when you look at it over data and you look at it, it's all associated with risk. So that's really, it's about risk stratification, Jess, and just like when you go to get life insurance, right? You pay a higher premium based on age, based on your comorbidities, and based on your habits. So again, we do that here at University of Kansas Health System, right, as part of our health screening. Are we a tobacco user? Are we vaccinated? All those things, just like any employer. So that's an employer's choice, but I would say it's truly looking at the risk stratification of that population.
So David had a comment. He said, if insurance companies stopped covering COVID-related hospital stays for unvaccinated people, bet more people would get vaccinated. Do you think that'd be the case?
These are great questions.
Yeah.
I'm not sure. We're healthcare providers. We got to stay in our lane around that. And I in no way want to say that people who don't get vaccinated should lose their healthcare insurance. So I'm not going to advocate for that. But I do think there is, just as any other risky behavior, if you have multiple car wrecks, your insurance goes up, right? Does. If you have a lot of bad behaviors around your health care, your insurance is probably going to go up. So I wouldn't be surprised to see if behaviors around COVID-19 or SARS-CoV-2 will dictate to some degree pricing of your insurance. That would be consistent with what we've seen in the industry before. And I don't know that that's wrong. I mean, again, if you make a choice, you have to be ready for the consequences of that choice. And that's pretty simple, right? My daughter would come down sometimes in the morning when she was young, my oldest daughter, and she's a great kid, love her to death, but she would sometimes come down in the morning, and the school where she went, high school, had this rule. And the rule was that you couldn't let your belly button show when you're at school, right? And the test was, if you raised your arms up and your belly button showed, you couldn't wear that. You had to have something else to wear. So she came down one morning, and she's a feisty kid. I love you, Ilea. I love you dearly. She would come downstairs, and I'd say, okay, Ilea, no, it doesn't. And she'd sit here like this. No, it's not going to show, Dad. And I'd say, Ilea, raise your arms up. She raised her arms up. Oh, the belly button shows. Wait, go change the clothes. Come down. Same thing. This happened like 3 times. Finally, my other kids said, Dad, we're going to be late for school. I'm like, okay, Ilea, you're not going to school. Well, I got to go to school. I can't be late to school. I'll be in detention, blah, blah, blah. What? It's a choice. Go upstairs, get changed. I'm going to take everybody else to school. I'll come back and get you. Tears, 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 tears. My other kids were like, oh, thank God, Dad, you did that. Went to school, dropped my kids off, went back, got Ilea, just dressed appropriately this time, and we got to school. It's the last time she ever did it. There are consequences to your choices. What are your consequences? What is your story going to be? There are consequences to our choices. So be ready to live with those consequences, which is losing your job, losing your income, stressing out your family, potentially losing your family when you develop all the problems in healthcare and things like that, paying more for your health insurance. There's a consequence to being unvaccinated. And the problem in the United States is that we've made this a political fight, or we have made this a historical one over discrimination in different institutions to populations such as African Americans. But at this time, in this moment, this vaccine has been tested against in all populations of all backgrounds, and it's accessible and free to everyone. And there are consequences to our choices.
Stephanie has a question. She's in New York this morning, and she says, can you please comment on pros and cons of vaccinating teenagers over 12? She says there's lots of people here in New York who refuse to vaccinate because they've heard about blood clots in girls and myocarditis in boys.
Yeah, you bet. So here's what we know. Blood clots are an extraordinarily rare feature, mostly found in the J&J vaccine or AstraZeneca. We don't give that in the United States. And if you want to, you don't have to get that. You can get Pfizer, Moderna. But just to say, J&J's vaccine looks pretty darn effective. And those are incredibly rare outcomes. The problem is that what you really have to wrestle with is that if you don't get vaccinated, Hawk, the chances of a bad outcome from COVID-19 are markedly higher in those who are unvaccinated than those who are vaccinated. That's the real question. Also, myocarditis in young people, especially those over 12, we know, tends to be very self-limited. It doesn't result in the hospital, no big problems, but myocarditis in young people from COVID-19 is bad news.
Yeah, I mean, we know this. There is medical data to support this. The overwhelming amount of medical data supports this. And really, any possible side effect or down effect of the vaccinations is extremely rare, just as you said, Steve. We know that adolescent boys who get the infection have a 6 times higher risk of having myocarditis. We know that adolescent girls who get the infection have a 21 times higher risk of getting myocarditis than compared to if they got the vaccine. So we know this. So, you know, we are just wanting people to not roll the dice, because you are rolling the dice with your children's health, and they don't really have that ability to make those decisions. So really trying to give them the most opportunity to remain healthy, to remain in school, to not have those long haul symptoms, to not have that risk of the multi-system inflammatory disorder. You know, the vaccines are overwhelmingly safe and effective at preventing COVID-19, and as we have seen, and we are all happy about this, Steve, reduce risk of long COVID symptoms as well.
Jennifer says, yesterday there was an anti-mask rally in front of Blue Valley School District offices. A former political advisor from Iowa led this rally. It was a small rally, but it was live streamed. The speaker encouraged children at school to remove their required masks during the day, which of course would include kids ineligible for vaccines. So she wants to know, what would the doc say to parents who might be swayed by this type of messaging and questioning whether or not their school kids who are unvaccinated should be wearing masks?
I mean, I'll start. You know, medically, that's the wrong decision, the wrong choice, the wrong messaging to send. Again, for those things that we've just gone over, not only is it vaccines that help protect kids, but we have good evidence now, real-world evidence, large random controlled trials about masking and its effects on decreasing incidence rates of SARS-CoV-2 in the population. We have good school-based data about masking and other non-pharmaceutical interventions causing decreased rates of spread in those schools. So if you want your children to stay in school, if you want them to not be home and be isolated and go through those things that we've heard about, the depression, the other issues that occur from not being able to go to school, then continue to not mask. But if you want your kids to be able to go to school and have a healthy emotional social life, it is doing that masking in school. We know that there are people who continue to say that it affects children negatively wearing masks, and it affects their social well-being, their emotional well-being. That certainly is not supported by the data. That is not supported by those groups that spend almost every waking minute of their careers looking at children's health, the pediatric associations, the physicians, the scientists. So that's what I would say. That argument, that protest is not based on medical reality. That is based on other issues and opinions that they are having.
And may I follow up? Every single day, we prove that masking works in our health system again and again and again and again. We have a surge of COVID patients in our hospital every darn day. And our employees don't get sick. And why is that? What do? We wear a mask. To what Hawkeye said, if you want to get your school kids sick and close the schools and have them be isolated, take off your mask. Great strategy. It's going to work. We've proven it again and again and again. We proved it last fall, how well that works. If you want to keep your kids in school, learning and not isolated, and being able to start kindergarten so they're ready for first grade, then by God, wear a mask. It is just not that hard.
And I would say this doesn't look to be a masking, an issue that is going to be going on indefinitely. There will be an end to this. We don't want to wear masks. We don't want to have to wear masks in our social situations and things that we're doing. But right now, in those situations, in those high-risk situations, such as being in a room, in a closed environment with each other, that is when masks do help the most. And eventually we won't have to do that. But for right now, we need to continue to do that, as well as continue to endorse the vaccination of all those that are eligible.
Ashley says Israel is one of the most vaccinated countries, and they are seeing a huge surge in infections. Can you speak to that?
Yeah, it's still in the unvaccinated population, even in Israel.
Yeah, and again, what we would like to see ultimately is that if all of our patients that were coming to the hospital were vaccinated. Why? Because that would mean that overall our numbers our numbers of infected people coming to the hospital are overall going to be much lower. There are also caveats with the Israeli data as well, including some of the data collection, some of their denominators, their numbers, their data analysis. And again, it is a significantly different population than it is from the United States. So there are behavioral differences with that as well. But overall, Israel has done very well considering pre-vaccination versus now post-vaccination times.
And even amongst those who are hospitalized, there's still an overwhelming number of those who are unvaccinated are the ones being hospitalized. Their vaccination rates are good, but they're not perfect. They're not 90%. So, Jess, one more question.
Michelle says, I'm hearing more and more that those that are vaccinated are dying or can die. How rare is it? With all the different information out there, how do we know who and what to trust? I'm vaccinated, but what does that really mean? How protected am I really?
Yeah, no, it's a great question, and it's one we're going to be taking on increasingly in this program over the next few weeks, because we've got some good information to share. But the reality is that 98% of deaths are in the unvaccinated population, 2% are vaccinated. Now, our number is higher than that. And then the reason it's higher is because we take care of so many organ transplant patients and people with end-stage cancers and malignancies and hematologic malignancies, which mean you're on all this aggressive chemotherapy. Because what we're seeing is that those who are vaccinated and who are dying from COVID-19 are people with significant other comorbid illnesses. And one of the things we even have to ask ourselves is, are they dying from their illness, or are they dying because they have COVID-19 and the COVID-19 was incidental? So we're going through that information to figure that out. And we'll be really honest and transparent about it. But we know that 98.2%, I believe, is the number I saw, Hawkeye, and you can comment, of the deaths nationally are in the unvaccinated population. So I think it really, can you die if you've been vaccinated? Yes, you can. It was 95% effective and not 100%. But the risks are markedly reduced. You saw that infographic that Hawkeye showed a little bit ago, that your risk of dying was 10 times greater if you're unvaccinated than more than 10 times greater if you're unvaccinated than if you're vaccinated. So I think that's the real key, Hawk.
Yeah, I think it's continuing to seek out those sources of truth. Again, we have people concerned about what is the real data. Go to the FDA. The FDA has all the raw data, all the interpretation analysis of all the vaccine information. Go to the CDC, go to those publications, the MMWR, that infographic that we just showed was from MMWR. This past week, they've had 3 very good articles, and since the time of vaccination, they've continued to put out articles. But they had 3 very good articles stating that even during this time, the time of Delta, and so far out from when initial vaccinations were offered, that the vaccinations continue to offer protection against hospitalization, severe disease, and death. And so it's important to understand your sources of truth and seek those out. And if you need to, although you may not necessarily be used to reading medical literature or trained in reading medical literature, try to seek out some of those sources of those publications, such as the CDC or your local or state health departments as well. And I think sticking with that and understanding those sources of truth rather than other unverified sources of truth or social media, I think is going to be important and continues to be important moving forward.
Colette, final thoughts from today.
I think just final thoughts are, we're always here to help. So, whether you're, have a bill you didn't expect, whether it's due to COVID or something else, we're always here to help. We have a whole team of financial advisors to help you in any way that we can. But really, when we think about COVID, it's about think about your risk and think about the consequences of your behavior and to really consider not only your health, but also your financial health and what this could mean to you and your family.
Hawk?
I think it continues to be, hopefully we are seeing our hospitalizations continue to decrease. I think vaccination overall is a big part of that. Continue to understand that vaccination, even now, as I said before, even after vaccinations were offered in December and January and early in the year, they continue to work and significantly reduce your chance of these adverse outcomes. So continue to get vaccinated.
So tomorrow, Jess is back with us on the Morning Medical Update. Delta is different. And here's another example of why. Unvaccinated pregnant women are getting seriously ill compared to the first surge in COVID cases. We break down the dangers ahead and how you can easily protect your unborn child tomorrow morning at 8 a.m. So, as we say goodbye, we're still hearing talk of the community about masking. People who cling to the myth that masks don't work and can harm you, and they want to do away with masking. Ooh, we just heard that question earlier today. Monday, we're going to hear from the authors of mask research published in JAMA. That's the article I referenced earlier today. It's going to be Monday, although tomorrow's Monday. The data was collected right here in Kansas that proves the power of masking. We're going to revive a video that Hawkeye and I made back in the freezer. And now we're not going back to the freezer. We're just going to show the video again. But in the meantime, a couple of quick points. First of all, fourth season of Discovery drops here in October. You want to stay alive for that, so make sure you're vaccinated because, you want to be able to live long and prosper and watch that next season of Discovery with us. Second of all, truth or consequences? Truth or where do you find the source of truth? Do you find it? You said something so good earlier. You say a lot of good things, but earlier today you said people who spend their lives looking into the things around the pandemic, studying the epidemiology, studying the viruses. We bring many of those experts here on this program. Dr. Poland from Mayo Clinic, the folks who do TWIV and virology and things. We've brought so many people on, and these are people who spend their entire lives focused on this kind of a question versus the made-up news network and the stuff you read on the internet. Truth or consequences? Truth or consequences? That's the choice that we have. And remember, we are all in it together. Tomorrow, back to the freezer, back to wearing a mask. We'll talk about it more when the day comes. Thanks for being with us today. We'll see you soon. This is Steve Stites, Chief Medical Officer at the University of Kansas Health System. I'm back in the freezer with my good friend, Dr. Hawkeye.
Hi.
We're here to make a point about masks. Doc Hawk, he's got his surgical mask on. I've got a cloth mask. But all masks can help keep us safe. And you can tell you don't see our breath. We take our masks off, and what happens? Now we talk. There's our breath. We take a deep breath. Man, I've got your breath in my face.
My mask doesn't work well here.
What if we just put it under our nose? Does that really do any good? Not so much. So remember, let's keep each other safe. Let's keep our masks on. . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . .
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now everywhere podcasts are available.